The dimension, as health workers in states and local governments have been directed to join this development, it has left activities of hospitals across the nation crippled, with patients left stranded. This report takes a look at the effect of the strike in some states.
Just when it seemed the worst had been experienced in the nation's health sector, the situation might even get uglier with this new directive from Johesu to state and local government members to join in the strike. At the University College Hospital, UCH Ibadan, this walkway is a shadow of itself, same as every other place where patients and caregivers will normally be seen in large numbers. But that is just one side to the effect of the nationwide industrial action by Johesu. Elsewhere at the Federal Medical Center, Owo, Ondo State, the atmosphere is also unusually quiet, no thanks to the strike. None of the members of Johesu are on the ground to speak on the situation, and the chief medical director of the hospital is said to be in a management meeting. The situation at the Aminu Kano Teaching Hospital in Kano State is even much more dire for a hospital that serves neighboring Katsina and Jigawa states. At the Accident and Emergency Unit, this patient is wheeled in, his fate unknown. Other patients tell their story.
As at last week, we had to go outside. Even if you see the doctor, it's of no use. You see the doctor without getting the drugs. Of what use it is.
I just really hope that Johesu will call up this strike because it's really telling on us here.
The few medical staff around do the little they can, but it's not enough to put a smile on these faces.
We are prevented from admitting some of our patients since some of the wards are locked and some of the materials for the patient bed and other things were locked by the Johesus.
The state Johesu chairman believes the government is responsible for this situation.
You see, one good thing people must understand, the responsibility to give good health, affordable health to the country is the duty of government. And that is to tell you it is their responsibility. They are only using us as a tool or as an equipment to do that.
Members of Johesu at the Federal Medical Center in Yenagua have taken the strike a step further by manning the gate and staging a mild protest.
Every working day we're here. That is the more reason why you are seeing us here, monitoring by making sure that none of our members gets to the office.
Locked gates, padlocks, and even more padlocks. The wards, laboratory, pharmacy, and even the cash machine all deserted. But the union says it shares in the pains of the people.
We appeal to the public, general public, especially the bystanders and non-bystanders in this area that we provide services to bear with us. We have no other, that was just our last resort.
The Joint Health Sector Unions, Johesu, is made up of 5 registered unions, all of them on strike. And if hospital beds meant to give comfort to patients are empty, the question is, how are patients getting the medical attention they urgently require?